Hi, this is Andrea, and I wanted to cover with you how to utilize the online codebook. So if you go into Brightspace and you come down here under announcements, you'll notice that there was an announcement about the codebooks that you're going to use for online. One of the things I want to point out is that it turns out our password to AHIMA had changed, and I was able to get that new password and put it in. So you've got it. But the first one I'd like to show you how it works is the one from the CDC. So if you click on this link, it will take you here to the CDC, and you will see that you have ICD-10-CM. Then it asks you which fiscal year you want to use. Make sure that you use the most current. So that would be fiscal year 2021. So click on that button. Now you come down here to enter terms. If you have the code, you can put the code in and then click view, but we won't have the code. For us, we're going to look it up by term. So for the first one, I thought we would talk about congestive heart failure. So the first thing I'm going to type in is heart and failure. And the system will automatically, you don't even have to hit enter. You just type in heart failure and it'll bring you up to all the codes in the index that have anything, or I'm sorry, all the diagnoses, not codes, but all the diagnoses in the alphabetic index that have to do with heart failure. Let's say that I don't know which one it is. I have no idea. All I know is it's some type of heart failure that's congestive. So let me look over here and see if I can find congestive heart failure. And there it is, right there. So I came down, I looked at all these, and I found congestive. So I'm going to click on this I-50.9. When I do that, it takes me to the tabular. And in the tabular, then I can start to narrow it down. Now, again, it's based on the documentation in the chart. If the doctor doesn't tell me or the provider doesn't tell me whether it's acute, chronic, left heart, right heart, both, all of that, all I know is that it's congestive heart failure unspecified. So that has to be my code. But before I say for sure it's I-50.9, I need to come over here and take a look at all these little icons over here. And if you're at the top of the screen, it shows you the legend and it'll explain what each one is and why you need to take a look at it. And as you can see, not every single one of these items applies to each diagnosis. It's specific. So if I come down here, it's going to tell me that I-50.9 includes congestive heart disease and congestive heart failure not otherwise specified. And it also includes heart or myocardial failure not otherwise specified. So that's what the code includes. Then I look at this code first. And what this tells me is that if there are any of these other conditions, they get coded first. And then excludes one, tells me what I absolutely cannot use this code for. So for instance, if this were a chart for a neonatal cardiac failure patient, it's telling me I cannot use I-50.9 for that. I have to use P29.0. And then excludes 2 talks about things that may be additional or related to, and I need to make sure that I code those as well. So for instance, if fluid overload is an integral condition of heart failure, they usually come together. But let's say this patient, for whatever reason, has fluid overload, and that's unrelated to the congestive heart failure. It's telling me here to code also E87.70. So that's why you need to look at these notes, and you need to be thinking about the chart. Let's do another one. To get out of here, you go back up here, and on the top, right hand side there's that gray X. You click on that and it'll take you back here and you can change your term. So let's say that we've got a patient and they have sinusitis. So I type in sinusitis and it takes me to all these different ones that have sinusitis in it. And let's say all I know is that it's acute. So I click on this J01.90. So acute sinusitis, that's all I've got. If I know from the chart that it's maxillary or it's frontal or it's recurrent, I can click on those. But if I don't know it's any of those and my provider hasn't given me those and I don't query the provider for whatever reason, then it's taking me to J01.90, acute sinusitis unspecified. But again, before I code that, I need to go over here and look at what's included in the code. I need to look at, or I'm sorry, this is information about the chapter. Then what's included in the code. When do I need to use an additional code? What is absolutely excluded from this code? And what might I need to code as well? And when I'm done, again, I can click close, or I can go up and use the little gray X here in the top right corner. So that is how you do it. All right, now I'm going to go back to Brightspace. We'll see if it does that for me. Might take me a few clicks. There it goes. Okay, so now I'm back to Brightspace. Great. All right, now I want to try the 3M AHIMA link with you. Make sure your PC settings allow this web address to allow pop-ups. So I've already done that with my computer, so this should work. Now remember, it said here you needed the username and password. The username is NEI001. So I'm going to type in here NEI001. And the password is AHIMA pound 21. And for me, I'm going to remember this password and log in. And it may take a minute or two for it to go through all of the firewalls and access points that it needs to. And then again, it may be my internet or it may be my computer this morning. Okay, this is what should be popping up. We're using a 3M product through AHIMA. You can choose whatever you want to fill in for this information. If you were in a hospital, it would be integrated with your system, or in a physician's office, and all of this would automatically populate through your ADT interface, admission discharge transfer information interface. For the purposes of today and what we're coding, I would make sure that you put in an age that is greater than 65, so like 66. You don't really need to worry about admit and discharge dates, although you can play with those. You can also change from female to male. You don't need to put in any other things. You just click on continue. For the purposes of what we're doing, you always want to choose home or self-care. So just always choose home or self-care when you get to this screen. Well, maybe it will, maybe it won't. The joys of technology, right? We'll see if I can get it back or if I'm going to have to start over. I'm going to guess that I need to start over. Okay, here we go. All right. So if I don't put in an age, it tells me an invalid age. That's why I do it. Then you click home self-care. Now notice that's asking you for an admit diagnosis. This would be the same as your primary diagnosis on the outpatient side. So let's say you have a patient who comes in with shortness of breath. You just start typing in short breath. Do we know anything else about this? Is the patient having cardiac arrest? Are they having distress syndrome? Are they in respiratory failure? Do they have tachypnea? Other unspecified. Well, we're going to say other unspecified. So now it gives us the code R06.02, shortness of breath. You click continue. Your principal diagnosis should be the same as your admitting diagnosis when we're talking about the outpatient side of life, which we are focusing on. So I'm going to type in short again and choose breath, choose other unspecified, and click continue. So now it shows you that my admitting diagnosis and my primary diagnosis are the same. If I have some additional diagnoses, I click on add diagnosis. So let's say that this patient also has a rash. So I'm going to just choose rash. If I know what it is and I can choose it based on the documentation in the chart, then that's fine. If I don't have that, then I have to click other. And then it says R21 is rash, other unspecified skin eruption. And I click continue. Let's say this poor individual, let's add a diagnosis and say that they also have leg pain. Okay, so I'm going to say leg condition. I'm going to choose pain. It's going to ask me where. I'm going to say lower leg. Is it bone, muscle, other unspecified? We don't know. Which leg is it? Let's choose left leg. Do we need to code any other pain? Probably not in this case. And so we don't have anything else to go with. We just click that and it gives us now M79.662, which is pain in left lower leg. We click continue and you can see how we're building our screen, right? And these nosology edits, they're really primarily for an inpatient setting, and it's basically telling me if I know what that shortness of breath is due to a definitive diagnosis, then I shouldn't be using it as an admission diagnosis or a principal diagnosis. But in this case, we're in an outpatient setting, and so that's what we have. We're using it just to get the codes. So that's how you can use 3M to get the codes. Personally, I prefer the CDC's website because I think it's easier for what we're doing. But 3M is also here if that's what you'd rather use. And 3M is most often used in hospitals or in healthcare organizations that are hospital based or affiliated with a hospital, I should say. All right, so that shows you how to use those when you're done. Obviously, you can click to next patient and it takes you back here and you can start over again. To get out, you just click out of the red dot at the top left like you would any other program. Best of luck with this. If you have questions or comments or concerns, you know how to reach me. Take care and have a great week.